International Livestock Research Institute. So pastoralists' actual income is not diversified, and our pastoralists, let's say 80 or 90 or 100% depend on animals. And this close relationship with livestock increases the risk of transmission of zoonotic diseases. And so what was the problem of doing this research? The proximity to livestock actually increases the risk of zoonosis transmission from animals to human. And there is also difficult accessing basic services by these communities. And there is also uncontrolled livestock border movement, particularly the border we have with Kenya and the one we have with Ethiopia. And so there is little is known about Somalia's zoonotic diseases. So there is a need to systematically compile and put together and summarize the available literature in this area. So this was our study question. What is the available evidence of reported zoonotic diseases from the country? And we were specifically interested in to know what were the study types used and what was the scope and what methods that studies used, and lastly, who were the researchers, who was doing the research and who was funding the research. So our methodology, we searched this website, this database called Web of Science. That's a bigger database, let us say, which hosts many other databases, including PubMed, Midline, and so on. And we found 535 records, and from our search, can you go to the next slide, please? Because I can't. Okay. And so we used a website called Covidence, which is a systematic review management website that will help you to import the references out of the 532 references, and then screen the title and abstract, and then full text review, and then data extraction from these papers. So this was our inclusion criteria. We considered including all studies with total or partial focus on one or more zoonotic diseases in Somalia, studies that involved strains from Somalia, studies of migrants and refugees from Somalia. That, for example, there were some studies that people were positive on some zoonotic diseases, but they were not in Somalia. They were refugees that left the country to Europe or America. And we also included reports on zoonotic infection of foreign staff deployed to Somalia, particularly in 1994, 1993, there were some soldiers, that's what we call Storhopia. So they were screening some zoonotic infections. So we found many papers in that years. And then from the exclusion criteria, we excluded all these diseases, but because we have many diseases that have a zoonotic aspect and the non-zoonotic aspect. For example, tuberculosis, we have bovine tuberculosis, which is zoonosis, and then we have another tuberculosis, which is not zoonotic. Leishmaniasis, similarly, schistosomiasis, where zoonotic aspects were not considered. So we removed all of them. We also removed those their focus or that focused on established Somali populations in Kenya and Somalia. There were some studies that are happening in Somalia, so we considered them in neighboring countries. We also excluded dengue, yellow fever, and chikungunya and Zika viruses, where evidence of zoonosis was not shown, because these diseases are zoonotic because they come from animals originally, but currently we have human transmission. So we also excluded studies that are not written in English, in other languages, because there was some Italian written literature, studies that are not relevant to zoonosis in Somalia, those who don't have like full text and so on. And this was the Prisma flow. We found 532 papers at the beginning, and then we screened abstract and title of 485 papers, and then we extracted full text of 251 papers, and then when we removed these irrelevant papers based on the criteria that I have showed you recently, we ended up like extracting data from 76 papers. Okay. So the timeline. So the studies ranged from 1968 to 2000, and yeah, as I told you earlier, like 1992, 1994, there was a spike of like studies, but all of these studies were not relevant actually, because they were only screening and testing like solitaries that came to the country. And recently, after 2010, there is also an increase of publications on zoonotic diseases. And so the major findings in our systematic review include publications range like from this range, and only 19% of papers had at least one author with Somali affiliation, being first, last, or a co-author. You see, only 20% like was written by Somali like researchers. The rest were foreigners. Most of the studies reviewed had a zoonosis focus, like 55%. And most studied zoonotic diseases include Rift Valley fever, brucellosis, hepatitis E, followed by CCHF and Q fever, echinococcosis, and salmonellosis. And most of the studies are descriptive studies. There were little analytical studies, serological surveys, period. Most of them are serological. Little molecular work is done, and weak local laboratory capacity. Most of the samples were also transported outside of the country for analysis. Okay, well, I'm finishing. And then the domains, One Health domains, like 35 papers were from the human side, 28 from the animal, and only 6 papers were from the environment. Almost finishing. Can you please go ahead to the next slide? Because I'm having problems. Okay, almost finishing. Yeah, conclusion. So evidence, we found 22 zoonotic diseases identified, and compared to other neighboring countries like Ethiopia and Kenya, like there's little research is done in the country, and there's need to empower actually local researchers so they can do more research. And lastly, we actually impacted the policy by informing. So actually, we published the zoonosis research in Somalia here, and then the findings from our study actually informed zoonosis prioritization for multi-sectoral One Health collaboration in Somalia, which happened last year. So that was the basis of prioritizing Somalia's zoonotic diseases last year. And the priority zoonosis include Rift Valley fever, Middle East respiratory syndrome, anthrax, strep, brucellosis, zoonotic enteric parasites, and zoonotic influenza viruses. I think that was the last slide. Thank you very much for your time.